medical groups in Bicol warn of an India-like COVID-19 surge if the region does not shift to stricter quarantine rules. In a joint letter to Interior Secretary Eduardo Año, the groups asked that the region be placed under a stricter quarantine classification. The Philippine College of Physicians Bicol chapter tells CNN Philippines private and public hospitals are full and now lack medical equipment. But Sorsogon Governor Chiz Escudero refutes the group's statement. And we now talk to Philippine Medical Association Governor for the Bicol region, Dr. Ricardo Isip. Good morning, Doctor. Thanks for being with us this morning.
Good morning, Ria.
Now,
Thanks for having me.
Governor Escudero says that the occupancy rate for quarantine facilities in Sorsogon is only at 38% and 56% for COVID-19 beds. What's your reaction to this? And from what you've witnessed, what is the situation in Bicol right now?
Well, I have to agree with the good governor because you see, when the group drafted the letter last May, the surge was ongoing, and then we were actually preventing the possibility of being overwhelmed. There go the rationale for the writing of the letter. The trend was there, the cases were rising, and we did not want 100% capacity for the COVID designated beds.
All right, so it is not, when it comes to hospital utilization rate, you're not at 100%.
Well, it's a little bit tricky, Ria, when you count the hospital beds and you base your assumption from the total number of the hospital beds, not considering the human resource wherein some of these nurses and doctors are going on quarantine after they serve for like 7 days straight in a COVID ward. So you have to go on quarantine. So this system would minimize the number of healthcare personnel doing the duty on rounds. So it's not 100% every time because some of this personnel get infected and they are quarantined. So, and there's no mechanism to change or to replace these people who are employed. There you go, your 100% is not always attained. That's why when you read the specifics, you read the percentages, it's not always 100%. So it's a little bit tricky when you say 100% bed occupancy.
Right.
So that's how we explain it.
Okay, Doctor, what has the reaction of the local government been to this surge?
Well, we were... precisely the letter was it's a wake-up call, not just for the leaders, but also for the community members to be stricter in implementing the minimum health standards, because there's seem to be laxity and complacency with regards to the community where there are small groups gathering. And we believe these are the groups that where you get the transmission. Mm-hmm. If you have the minimum healthcare protocols in place and there's no one monitoring them, so complacency would set in.
Okay.
The local governments are doing their job, but I think there should be more strict in implementing these minimum health quarantine standards.
All right, when it comes to the national government, Doctor, have they been helping?
With regards to the Philippine Medical Association, when we raised this letter, they wanted to endorse this to the national IATF, and we really appreciate them. I believe so that the national government is helping the local the LGUs. But again, this is not just a job for the LGUs and for the national government. It's a universal job for the community, for the healthcare professionals, and for the LGU. So it's all hands on deck. So that's how I think we should approach the problem.
Yes, it is everybody's responsibility. Thank you for your time this morning, PMA Governor for the Bicol region, Dr. Ricardo Isip.